So I'm going to keep on talking about the medical gaslighting in Incline Village, but I want to expand out. One of the things that was interestingly enough going on at the same time is that a small town about 20 miles north, Truckee, some people were having issues with sick building syndrome, where they were getting sick in the building, which is what sick building syndrome is. The interesting thing, this was actually happening, again, about 1984. So to keep these things in perspective, Dr. Shoemaker discovered chronic inflammatory response syndrome, which is part of sick building syndrome, in 1996-97. So basically, 84 to 96, 12 years previously, people having issues with water damage building issues 20 miles away from where they're having the issues in Incline Village. And the reason this is important is because the concept of sick building syndrome, the concept of water damage buildings, the concept of chronic fatigue fibro, these things actually were going on even before pioneers discovered it quite early. And how does this play into medical gaslight? A lot of things people have issues with was depression, anxiety, chronic fatigue fibro. People have problems with it decades before actual diagnoses are made, when it's actually a thing. So this is important, especially today with post-spiral syndromes, long COVID, a lot of our health issues. People are having these things pop up years, sometimes decades before the official diagnosis. I remember with long COVID, I saw my first case of long COVID, May of 2020, before people knew what it was. Well, again, for chronic fatigue and fibro, this was going on, Incline Village, 1984. And the concept of medical gaslighting is a big thing to think about. And it's not just modern day. You think about Ignaz Semmelweis, who was the guy who discovered hand washing. Well, he had lost his entire career over the concept that not washing your hands could cause illness in the hospital. I think about smoking, how for years smoking was said to be good for you, it's healthy for you, it's not bad for you. I think about things like frontal lobotomies that were used commonplace for treating people with mental health issues. So the concept of the health system thinking they know things right and not being right is actually not a new concept. It's actually quite an old concept. And going back to Epstein syndrome, which is something that women were dealing with early on around Incline Village, is that now, I'm recording this 2025, we now know what chronic fatigue fibromyalgia is. We now know that it's actually not just to Epstein-Barr, but other viral infections, other infectious disease issues, water damage buildings, and a bunch of other things, post-Lyme syndrome, breast implant illness. There's a lot of other illnesses that are known to be chronic inflammatory response syndrome illnesses. And unfortunately, the canary in the coal mine for a lot of these are women, related to the hormones, related to a lot of the sensitivities to different chemicals in the environment. And we really need to take this seriously. Unfortunately, medical gaslighting is still a thing today. My question for y'all is, what are we gaslighting our people with right now? Mastectomies, doing radical mastectomies for breast cancer in the 1950s, 60s, 70s. There's only in the last 10 or 15 years that became obsolete. So, and unfortunately, those who are at risk, those who are vulnerable population, which can be those lower socioeconomic status, it can be women, a lot of people are more likely to have issues with medical gaslighting. So I want to finish up here, keep on talking about this idea of chronic fatigue fibro being a medical gaslit disease, particularly for women, and say, what was missed in Incline Village? Because the article and the stuff I was looking at specifically talked about causes related to herpes, related to Epstein-Barr, related to CMV. What they missed, the elephant in the room they missed, was what was making people sensitive to and susceptible to chronic fatigue, such that you saw this act. And we're going to talk about that next time and help you understand that these things are not new. They've actually been around for a while. It just takes the medical system years and sometimes decades to see what's right in front of them.